There's a pretty wide array of types of patients that come to see me, but there's kind of three main groups. The first group, which is actually the smallest percentage probably, are people that have time and are very interested and really just looking to optimize their health. So I definitely have that group of patients that aren't chronically ill. And so that's one type of patient that comes to see me looking for types of advanced testing that we do, or detailed recommendations about nutrition or supplementation or things like that. That's one group. It's the smallest group probably. The other two groups are, one would be the kind of patient that's had some kind of issue that's been long-standing, which could be months or for some people years, that they're not debilitated by, but they haven't quite been able to figure out how to get better. And the types of things that we do in functional medicine just really interest them, looking at the whole body and lifestyle on top of diet, on top of real medicine, therapeutics, kind of combining all of those things. And some people with those more chronic issues, maybe, like I said, not debilitating, but working to figure that out in a different way that interests them. And the last kind of patient that I see are some of your really sick, debilitated patients that have complex chronic illnesses that sometimes have names, sometimes don't have names, that have been sick for sometimes many years and have seen a lot of different types of practitioners and maybe still struggling to try to figure out how to live their best life. Functional medicine is and can be useful for pretty much any constellation of symptomatology or condition that exists. However, just like other specialty fields, different functional medicine doctors end up kind of making their own little niches and focusing on different things. So for me, in terms of the last 6 years that I've been doing functional medicine more consistently, I would say the majority of my patients fall into a few categories. So by far, the majority of the patients I see have some type of digestive issue, and that could be most commonly something like irritable bowel syndrome or small intestinal bacterial overgrowth. Or some people come because they have acid reflux or gastritis or things that where our lifestyle and dietary and nutritional interventions can really do wonders for these patients with these ongoing, not necessarily debilitating, but bothersome GI symptoms that affect their quality of life. So the GI section is probably most of what I see, but I have a lot of patients that see me for an array of issues with hormones. And that can range from sex hormones, thyroid, and even adrenal hormones. So I see a lot of women with PCOS. I see a lot of women going through perimenopause and menopause. I see women with endometriosis. Also men with andropause, or even young men. I've been seeing a lot of young men with issues with low testosterone lately. And I see a lot of patients for, again, thyroid hormone abnormalities and adrenal issues, which basically is cortisol abnormalities, or something we call the HPA axis dysfunction, is a very common problem in the world that we live in, and how stressful life can be that affects that brain adrenal axis. And there are things that we can do to help people with that. So the hormonal component is a lot of what I do as well. I do have a lot of patients that come to see me for anything autoimmune. So it doesn't matter what it is, really. From the perspective of a functional medicine provider, the diagnosis or the label isn't quite as important as it might be in other specialties. So, for example, anybody comes to see me with autoimmune disease, one of the first things that I'm saying to them is, all right, well, we need to do a stool test and take a look at your microbiome. I have rheumatoid arthritis. Why do I need to look at my microbiome? Because at least 70% of your immune system lines your gut. And if the microbiome is not healthy, that constant communication between the gut microbes and the immune system is not going to be happening properly. And so how is your immune system going to behave? It's not. There are no really qualifications that exist for somebody that has to meet X, Y, and Z in order to come see us here.